Today we're going to talk about chapter 12, which is the skin, the integumentary system. So the structure, there are new combining forms: skin, cutano, dermato, and dermal. Sebaceous glands is sebal. Sweat glands is hydro. Hair, pili and pilo. Nails, ungual and ungual. So the integumentary system consists of skin and its related structures, which would be the sebaceous glands, sweat glands, hair, and nails. Average adult has 2 square yards of skin, making it the largest body organ. So the functions of the skin: keeps the body waterproof, hence preventing fluid loss. When intact, skin blocks the entrance of pathogens. It contains receptors for the sense of touch, and it synthesizes vitamin D from the sun. So the sebaceous glands they secrete sebum that lubricates skin and discourages growth of bacteria on skin. The sweat glands then assist with body water content and temperature regulation. Hair helps control the loss of body heat. Nails, they protect dorsal surface of last bone of each toe and finger. The skin is specialized tissues. There's 3 layers. We have epidermis, dermis, and subcutaneous. And looking at this term, we can break it down. Cutaneous skin, OUS, is pertaining to. And here's structures of the skin. You can see the sweat and sebaceous glands are associated structure of the skin. So you have the epidermis, dermis. Here's your subcutaneous layer, muscle, artery. Here's your vein, sweat gland, pore, and your hair follicles here. The duct of the sweat gland is this area right here. So looking at the term epidermis, epi is upon or above. Dermis, skin, is is a noun ending. So this is the outermost layer of the skin. Contains no blood vessels or connective tissue. We have epithelial tissues. This is a form protective covering for internal, external surfaces of the body. We have a squamous epithelial tissue. This forms the upper layer of the epidermis. It is flat, scaly cells continuously shed. We have the basal layer. This is the lowest layer of the epidermis. We have keratin. This is a fibrous water repellent protein. We have soft and hard. The soft component of the epidermis, and then the hard is found in the nails and hair. Okay. Melanocytes, these are special cells in basal cell layer. They do produce and contain dark brown to black pigment known as melanin. Melanin then is a pigment that determines the color of skin, produces freckles and age spots. It also protects the skin from some of the harmful UV lights, or rays, I should say. Dermis, this is directly below the epidermis, contains connective tissue, blood and lymph vessels, nerve fibers, hair follicles, sebaceous glands, and sweat glands. Then the sensory nerve endings. These sensory receptors are for touch, temperature, pain, and pressure. Collagen. These are tough, flexible, fibrous protein found in the skin, bones, cartilage, tendons, and ligaments. Mast cells are found in connective tissue of the dermis. These respond to injury, infection, or allergy by producing and releasing heparin and histamine. The subcutaneous layer then is located below the layers of the skin, and it connects skin to the surface muscles. Lipocytes, they manufacture and store large quantities of fat. Looking at that term, lipocytes, lipos, fat, cytes is cells. The sebaceous glands, these glands secrete sebum, which is an oily substance located in the dermis. Sebum then is the oily substance released. These are released through the ducts opening into the hair follicles. They lubricates the skin. We have the mammary glands that produce milk. These are also part of the reproductive system. Sweat glands, pseudoorifice glands. These are located on almost all body surfaces. There's 2 types, apocrine and eccrine. The first one is found in the hair follicles, and the eccrine is open onto the skin. Most numerous in the palms, soles, and the forehead. You have pores. These are open on the surface of the skin. They act as ducts of the sweat glands. Perspiration, secreted by sweat glands. Evaporation of sweat cools the body. And 99% water plus salt and metabolic waste. Hydrosis is a production and excretion of perspiration. Hair, then let's move on to hair, composed of dead protein cells filled with hard keratin. The color of the hair is determined by the melanin. We have hair follicles. These are just sacs holding the root of the hair fibers. And then we have erector pili. These are muscle fibers attached to hair follicles that cause hair to stand erect, reducing heat loss. We have nails. Unguis is fingernail or toenail. Keratin plate protecting dorsal surface, the last bone of each finger and toe. We have the nail body. It is translucent, molded to surface of underlying tissues, make of hard keratinized plates of epidermal cells. Here you can see a picture, structures of the fingernails and toenails. So here's your nail body, cuticle, nail root, bone, nail bed is right here, and this is your free edge of the nail. So the nail bed just joins nail body to underlying connective tissue. We have the free edge, that's portion of the nail not attached to the nail bed. We have the lunula, is the half moon shaped region at nail root. With the cuticle, the epidermis attached to the surface of the nail, and we have the nail root. And this just fastens nail to finger toe. Let's take a look at some of our medical specialists. We have dermatologist. So dermat is skin, logist is specialist. So this would be a specialist in diagnosing and treating disorders of the skin. We have a plastic surgeon, plastic surgical repair. So this is a specialist in surgical restoration or reconstruction of body structures. We have a cosmetic surgeon. This is a plastic surgeon who performs operations for anesthetic rather than medical reasons. Aesthetic. Okay, moving on to the pathology. Sebaceous glands falls into that's acne. It's a chronic inflammatory disease caused by the overproduction of sebum around the hair shaft. We have the comedo. This is a non-infected lesion composed of sebum, keratin, and hair follicles. And we have the closed and the open. The closed is the white, is known as a whitehead. The open comedo is a blackhead. We have an epidermoid cyst. This is a closed sac just under the skin. Seborrhea. This is overproduction of sebum. Looking at that term, we can break it down. Sebum. Rhea is lower discharge. We have seborrheic dermatitis. This is just inflammation. And what this does is causes scaly itching of upper layers of the skin or scalp. We have a seborrheic keratosis. This is a benign skin growth having a waxy appearance. Commonly, you see this in the elderly, and it varied colors is how this shows. Anhidrosis, this is condition of lacking sweat in response to heat. Diaphoresis is profuse sweating. Heat rash, when you get a heat rash, it's just itchy rash, and that's related to the blockage of sweat glands by bacteria and dead cells. We have hyperhidrosis. This is the excessive sweating. And then we have sleep hyperhidrosis. This is excessive sweating during sleep. We have folliculitis. This is inflammation of the hair follicles. Trichomycosis axillaris. Looking at this term, we can break it down. Tricho is hair, mic is fungus, os is abnormal condition, axilla is armpit, and ARY is pertaining to. So pertaining to superficial bacterial infection of the hair shafts. These are in areas with extensive sweat glands, such as your armpit is where you'd find this. Hirsutism, this is excessive body and facial hair in women, usually occurring in a male pattern. Hirsute hairism is condition of hairy. Let's take a look at abnormal hair loss. We have alopecia, partial or complete loss of hair. Alopecia areata is an autoimmune disorder attacking hair follicles. Usually occurs in patches on scalp or elsewhere on the body. Next one we have is alopecia totalis, is loss of hair on the scalp. alopecia universalis, total loss of hair on all parts of the body. And then we have androgenic alopecia. This is hair loss due to hormonal changes. It does occur in both males and females. Moving on to the nails. First one we have is clubbing. So clubbing is just abnormal curving of the nails, and often is accompanied by enlargement of the fingertips, maybe hereditary also. We have cholonychia. This is outer surface of the nail is concave, and this often indicates iron deficiency anemia. Onychia. This is inflammation of the matrix of nail, and the person, this may result in the loss of the nail if you have the inflammation of your nail. Onychocryptosis. Edges of toenail curve inward and cut into the skin. Looking at this term, we can break it down. Onco is fingernail or toenail. Crypt is hidden. Os is abnormal condition. Onychomycosis, just as fungal. Infection of the nail. MYC is fungus. Paronychia, this is infection of skin fold around a nail. Par is near. Ankylosis is development of dark wart-like patches on one or more areas of the skin. And we have age spots. These are the skin pigmentation, discoloration caused by the sun exposure, usually when you get the age spots. Albinism, genetic condition characterized by lack of pigment in skin, hair, and irises of eyes. So albin, ALBIN, is what means white. Chloasma, this is brownish spots on face. This may occur during pregnancy, and then it disappears after the delivery of the infant. Next one we have is vitiligo, irregular patches of white skin related to destruction of melanocytes. Let's take a look at bleeding into the skin. First one we have is contusion. Contus is bruise, ION is condition. So condition of bruise is breaking that term down. Ecchymosis, echem is pouring out of juice. Os is a normal condition. So it's a large, irregular, purplish discoloration due to bleeding under the skin. So ecchymosis would be your bleeding under the skin. Purpura is multiple purple discoloration on skin. And this is due to bleeding underneath the skin. Now let's take a look here at this here. This is a cross section of the skin showing the bleeding under the skin causing ecchymosis. So you can see the damage occurs to blood vessels, and then your blood is leaking beneath the skin surface, causing the bruise. Petechiae, these are small pinpoint hemorrhages. They last less than 2 millimeters in diameter. They result sometimes from high fevers. Next one we have is hematoma, swelling of a clotted blood trapped in tissue. Hemat is blood, oma is tumor, so it's a tumor of blood. And usually you get a hematoma from an injury. Crust is just a collection of dried serum and cellular debris. Erosion is wearing away of a surface. Macula is a flat, discolored spot less than 1 centimeter in diameter. Macula, also known as a freckle or a flat mole. And here we have it here. So crust, see the crust here, is also known as a scab. Macule then is freckle or a flat mole, could be. See the papule, these are small pimples and insect bites. And then we have the wheal, which is also known as a welt, or it could be from hives or allergic reactions. You could get the wheal, slightly elevated, swollen area. Nodule is just a solid raised skin lesion larger than 0.5 centimeters in diameter. Papule is a raised red lesion less than 0.5 centimeters in diameter. Papula does not contain pus. We have plaque, scaly solid raised area of closely spaced papules. Scales, this would be such as psoriasis. This is where flakes or dry patches of excessive dead epidermal cells. So excessive shedding associated with the skin disorder, like I say, such as psoriasis, would fit in that category. Verruca, it's a small hard skin lesion caused by human papillomavirus virus, I should say. virus, also known as wart. So verruca is also known as a wart. A wheal, maybe due to allergic reaction. So it's that itchy bump. It's usually small. Abscess is just a closed pocket containing pus. That is due to a bacterial infection. Purulent, the meaning of that is just producing or containing pus. Exudate is fluid leaking out of an infected wound. A cyst, this is the most common type of a sebaceous cyst. Or the most common type, I should say, is sebaceous cyst. Pustule, these are small circumcised lesion containing pus. They're contained within a limited area, also known as a pimple. You can see here cyst here, pustule, vesicles, a small blister. Bulla is a large blister. So again, the vesicle does contain the watery fluid. Bulla is a large blister. Okay, lesions through the skin, we have abrasion. Could be abrasions, just a superficial layer. They're scraped away. Fissures, a crack-like break in the skin. Laceration then would be a torn or jagged wound. You can see here's a fissure. It's kind of like the groove or crack, like sore. And ulcer then is an open lesion of the skin or mucous membrane. And it does result in tissue loss. Pressure sore, these are just open ulcerated wounds caused by prolonged pressure on an area of the skin. So if a person's laying in a position for a certain amount of time, they often get pressure sores. With a needle stick injury, this is accidental puncture wound caused by hypodermic needle. And then we have an ulcer. Ulcer is just open lesion resulting in tissue loss, and that is around the edges. Also, the pressure sore would be like a bed sore, I guess, would be another name for that. Birthmarks. We have a pigmented birthmark. This is also known as a mole. We have vascular birthmark. These are caused by blood vessels close to the skin surface. We have capillary hemangioma. This is a soft raised pink or red vascular birthmark. It's a benign tissue mass. Hem is blood. Angie, blood or lymph. Vessels is oma. Or let me do that again. Angie is blood or lymph vessels, and then oma is your tumor. Then we have a port wine stain birthmark. This is a flat vascular birthmark made up of dilated blood capillaries. It does create a reddish purple discoloration. Let's take a look at the next term we have is dermatitis. Dermatitis is inflammation of the skin. Itis is inflammation, dermatitis skin. We have eczema. This is recurrent dermatitis, and this is characterized by redness, itching, and dryness. We have exfoliative dermatitis. This is a widespread scaling of the skin. And then we have pruritus. Just means prurite is itching. So it's an itching associated with most forms of dermatitis. So if you have dermatitis, you have the itching also that's associated with it, pruritus. Okay, let's take a look at the term erythema. Erythema. It's a redness of skin due to capillary dilation. We have erythema infectiosum. This is mildly contagious viral infection, common in children. And it's also known as the fifth disease. Maybe you've heard of that before, but this is also known as the fifth disease in children. Erythema multiforme. This is generalized allergic reaction to illness, infection, or medication. We have erythema perennial. This is purple, red inflammation occurring when small blood vessels below the skin are damaged. Erythroderma. Looking at this term, erythro is red, dermal skin, so it'd be red skin, which is an abnormal condition. Next, we have exanthum. This is just a widespread rash. And then we have what they call hand, foot, and mouth disease. This is a viral infection commonly in children under 5 years of age. The children get sores in their mouth, throat, rash in their hands and feet. Hand, foot, and mouth disease. Let's take a look at some of our general skin conditions. The first we have is dermatosis. This is, looking at that term, this is often denotes skin lesion or eruption of any type not associated with inflammation. So it's an abnormal condition, but it's not an inflammation. Next term we have is ichthyosis. This is hereditary disorders characterized by dry, thickened, scaly skin. Osis would be your abnormal condition. Ichthya is dry or scaly. Ichthyosis. Lipedema. Lip is fat, edema is swelling. So it's characterized by accumulation of fat and fluid. And this is in tissues under the skin or hips and legs. Systemic lupus. This is an autoimmune disorder. This is characterized by red scaly rash on face and upper trunk. Psoriasis then, this is where you have the red papules with silvery scales. Rosacea, these are tiny red pimples and broken blood vessels. And usually you see this commonly seen in adults 30 to 60 years of age. Next one we have is rhinophygma. This is hyperplasia of the tissues of nose. And this usually seen in older men. Rhino would be your nose in that term. Sclerodermia. Sclero is hard, derma is skin. So this is an autoimmune disorder. This is where your connective tissues become thickened and hardened. Urticaria. This is itchy wheals due to allergic reaction. Xeroderma. This is excessive dry skin. Xero, dry, derma, skin. Let's take a look at bacterial skin infections. Carbuncle. This is just a cluster of furnicles. Cellulitis. This is an acute bacterial infection, and this is with connective tissue. Characterized by malaise, swelling, warmth, and red streaks. Furnicles, these are large, tender, swollen areas. These are caused by staphylococcal infection, and this is around hair follicles or sebaceous glands. We have gangrene, commonly due to the loss of circulation to affected tissues. So it's death of tissue. And this usually is followed by bacterial invasion. It may also enter your bloodstream. Impetigo, this is common in children. It's highly contagious bacterial infection. We have necrotizing fasciitis. It's caused by group A strep that enters the body through a skin wound. This is also known as flesh-eating disorder, or flesh-eating bacteria, I should say. It's a bacteria that eats away. Pyoderma, pyo is pus, derma is skin. So this is just acute pus-forming bacterial skin infection, pyoderma. Let's take a look at some fungal skin infections in the chapter. Mycosis. Os is abnormal condition. Myco is fungus, so it's abnormal condition of fungus. Tinea, also known as ringworm. So it's a fungal infection. You can get on the skin, hair, or nails. Pediculosis. This is an infestation of lice, or with lice, I should say. Abnormal condition. Scabies is a skin infection caused by itch mites. Look at some skin growths they have. Callus is a thickening of the part of the skin caused by repeated rubbing. Cicatrix is just a normal scar. Granulation tissue is formed during healing of a wound. We have granuloma. Granular is granular, oma is tumor, so it's a small swelling of granulation tissue. Keloid. Oid is resembling. Keel is growth or tumor, so it's resembling a growth or tumor. Keratosis. This is overgrowth and thickening of the skin. Kerat is hard or horny. Lipoma, it's a benign fatty tumor. And then you find this between the skin and the muscle layer. Nevus is a small, dark skin growth developing from melanocytes. Dysplastic nevi, this is just a typical mole. They may develop into skin cancer. Papilloma, looking at this term, papilla is resembling a nipple, oma is tumor. So this is a benign wart-like growth on the epithelial tissue, or elsewhere in the body you may find it also. Polyp, these are just mushroom-like growths from the surface of mucous membrane. We have skin tags. These are benign. They're fresh-colored polyps hanging from the body by fine stalks, and they enlarge with age. They tend to enlarge with age. The older you get, the larger they get. Now let's take a look at some skin cancers that we have. We have malignant growth on skin. There are 3 types. We have basal cell, squamous cell, and melanoma. Skin cancers continuing, asymptotic keratosis. These are precancerous skin growth occurring on sun-damaged skin. And we have basal cell carcinoma. It's a malignant tumor of basal cell layer of the epidermis. This rarely spreads, the basal cell. So, like I said, this rarely spreads this one here. So we have squamous cell carcinoma. This can quickly spread to other body systems. So it's a malignant tumor. We have malignant melanoma. This occurs in melanocytes. Melan is black, almost tumor, so it's a black tumor. Burns. So burn is just injury caused by heat, flame, electricity, sun, chemicals, or radiation. The severity described according to the percentage of the total body skin surface affected or by depth or layer of skin involved. Some diagnostic procedures. Biopsy then is just removal of a small piece of living tissue. They do this just to confirm a diagnosis. So bias pertaining to life, opsi's view of. Exfoliative cytology. This is where the cells are scraped from tissue for microscopic examination. So preventive measures, obviously sunscreen, blocks harmful ultraviolet B rays or ultraviolet A rays. Burn treatment depends on the degree of burn and the percentage of body surface involved, obviously how they're going to treat it. So burn centers provide pain relief, debridement, dermoplasty, IV fluids, and nutritional supplements, along with antibiotics, cosmetic reconstruction, and rehab. So you can see there's, depending on the degree of burn, there's several different reliefs that they can provide. Tissue removal, they can cauterize it. Chemoabrasion, use of chemicals, cryosurgery, destruction, elimination of abnormal tissue cells, cryos cold surgery is operative procedure. So it's an operative procedure using cold. Curettage, removal of surface material by scraping it. They can debride it, and they can irrigate it and debride it also. This is where they pressurize fluid to clean out wound. Dermabrasion, they could use a wire brush or sandpaper. Electrodesiccation, destruction of tissue by the use of electrical spark. And then we have incision. This is just use of surgical instrument to cut open that lesion. They also have a Mohs surgery, and what this is a procedure repeated until margin that is clear of all cancerous tissue is achieved. So there's layers of cancerous tissue that are removed. They examine them underneath a microscope, so it's called Mohs surgery. Laser and light source treatments of skin conditions. We have a laser. This is a laser tube filled with solid, liquid, or gas substance. This is stimulated to emit light at a specific wavelength. We have a photosensitizing drug. This is administered topically or by injection. We have retinoids. These are derived from vitamin A and are used because of their effect on epithelial cell growth. We have atopic steroids. This is treatment of various skin disorders. They use the topical. Some procedures that we have, some cosmetic procedures that we have blepharoplasty. Looking at that term, blepharo's eyelid, plasty is surgical repair. So it's surgical repair of the eyelid. Botox, this is used to reduce moderate to severe frown lines, to treat migraines and muscle spasm. We have a collagen replacement therapy. This is used for soft tissue augmentation. We have dermatoplasty. Again, it's surgical replacement of damaged skin of a patient with healthy tissue taken from a donor site. Electrolysis, this is use of electrical current. What they do is to destroy hair follicles. We have lipectomy, surgical removal of fat from beneath the skin to improve physical appearance. We have liposuction, again, surgical removal of fat beneath the skin with the aid of a suction. Rhidectomy, rhided is wrinkle, ectomy is surgical removal, so it's surgical removal of wrinkles. Sclerotherapy, this is injection of a saline sclerosing solution for treatment of spider veins, non-essential veins seen through the skin. And that is it for the chapter. Thanks for listening, and please go to your workbook and complete the exercises for this chapter.